Hi everyone, welcome to my channel. In this video we are going to learn about serratus anterior. It lies along posterolateral wall of the chest. You can see here, it lies along posterolateral wall of the chest. It is also known as boxer's muscle, swimmer's muscle. Origin, it arises by 8 distillations from upper 8 ribs in the mid-axillary plane and from the fascia covering the intervening intercostal muscles. It arises by 8 distillations from upper 8 ribs. First rib, second, third, fourth, fifth, sixth, seven, eight. It arises from upper 8 ribs. In between the ribs, there are intercostal muscles. There is fascia covering these intercostal muscles. Serratus anterior arises by 8 distillations from upper 8 ribs and from the fascia covering the intervening intercostal muscles. Insertion. It is inserted into costal surface of the scapula along its medial border. Scapula has costal surface, dorsal surface. Costal surface is ventral surface. It is inserted into the costal surface of the scapula along the medial border. This is glenoid cavity, this is lateral border, this is medial border. First distation inserted into superior angle. Next two distillations inserted into medial border. The lower 4 or 5 distillations inserted into inferior angle of the scapula. First distillation inserted on superior angle. Next two distillations on the medial border. Lower 4 or 5 distillations on the inferior angle. Nerve supply. It is supplied by long thoracic nerve or nerve to serratus anterior. Root value C5, C6, C7. It is supplied by long thoracic nerve or nerve to serratus anterior. C5, C6, C7. Actions. Pushing and punching action. Due to its pushing and punching action, it is also known as boxer's muscle. Serratus anterior together with pectoralis minor protract the scapula forward, that is pulls the scapula forwards around the chest wall for pushing and punching actions. Serratus anterior and pectoralis minor pull the scapula forward for pushing and punching action. Overhead abduction of arm. Serratus anterior lower 4 to 5 distillations and trapezius lower part rotate the scapula and thus help in overhead abduction of the arm. Serratus anterior lower 4 to 5 distillations and trapezius lower part, they rotate the scapula and they help in overhead abduction of the arm. Keeps the scapula in position. It keeps the medial border of scapula in contact with chest wall. It is arising from ribs and inserted into scapula. Hence, it keeps the medial border of the scapula in contact with chest wall. Three actions: pushing and punching action. Serratus anterior and pectoralis minor together pull the scapula forward. Overhead abduction of arm. Serratus anterior lower 4 to 5 distillations. Trapezius lower part rotate the scapula and help in overhead abduction of the arm. Keeps the scapula in position. It keeps the medial border of scapula in contact with chest wall. Now let's see the clinical correlation of the scapula. Winging of scapula. Injury to long thoracic nerve causes paralysis of serratus anterior muscle. We know serratus anterior is supplied by long thoracic nerve. Hence, if there is injury to long thoracic nerve, it causes paralysis of serratus anterior. In this case, if a patient pushes a fixed wall, the medial border of scapula becomes prominently visible on the back. You can see here, if a patient pushes the fixed wall, the medial border of the scapula becomes prominently visible on the back. This condition is called winging of scapula. Paralysis of serratus anterior causes inability of pushing and punching actions. Serratus anterior together with pectoralis minor pulls the scapula forward, helping in pushing and punching action. Thus, paralysis of serratus anterior causes inability of pushing and punching actions. It also causes inability of overhead abduction of the arm. Clinical testing. Ask the patient to push the wall forward with the hands. Ask the patient to push the wall forward with the hands. Observe the scapular region of the patient. Observe the scapular region of the patient. In case of paralysis of serratus anterior muscle, medial border of scapula becomes prominent. Winging of scapula. In case of paralysis of serratus anterior, the medial border of scapula becomes prominent. Winging of scapula. Now let us review serratus anterior. Origin. It arises by distillations from upper eight ribs and from the fascia covering the intervening intercostal muscles. Insertion. It is inserted into costal surface of the scapula along its medial border. It is supplied by long thoracic nerve C5, C6, C7. Actions. Pushing and punching action. Overhead abduction of the arm keeps the scapula in position. Clinical correlation. Winging of scapula. Injury to long thoracic nerve causes paralysis of serratus anterior. If a patient pushes the fixed wall, the medial border of the scapula becomes prominent, called winging of scapula.